So now we're going to welcome Dr. Soumana Alphazazi, pneumologist and phthisiologist, National Coordinator of the National Tuberculosis Control Program in Niger, and National Consultant for the Union within the framework of the CETA project in Niger. He's going to present to us the mass tuberculosis screening in vulnerable groups using X-ray with CAD in the city of Niamey. The floor is yours. Thank you, Andrea, and welcome. Good evening, everyone. It's a pleasure for me to talk to you today of this actual screening of tuberculosis in Niger in the case of the use of the X-ray ultra-portable solution with CAD for TB. Before starting, I would like to thank very thankfully Delft Imaging for the trust that they gave us, the trust they gave myself to present, but also thank all my collaborators for this program, all my colleagues, both here on the ground and also in the country for that collaboration, which allowed to have the different results presented in this presentation. I would also like to thank Dr. Vicha for the technical assistance because this project is put in place with his collaboration, with his technical international help. We've been able to put in place that project. So we're going to talk about, firstly, of the project, first of all, in and of itself, and then go more specifically talk about the screening with the X-ray, the results that we're able to receive, and what impact did it lead on the program. But we're going to finish with the lessons learned, the different challenges that we've faced, and then conclude. This is our plan very shortly. Next slide. So I'm going to talk about the active TB screening in vulnerable groups using ultra-portable radio in the RECAM project in Niger. Next slide. Before starting, of course, I would like to talk to you about the context. Niger is a big country of more than 1,000 square kilometers with 26 million population, with a TB incidence of 74 for 100,000 inhabitants. We see a decrease in that incidence, and the treatment success rate at 88%. We have a good treatment coverage that is getting better over time. We went from 66% to 80% in 2023, but still we have rationale for the intervention that cases that are not being treated. Therefore, we have, through the program that we led in 2020, we were able to see where are those missing cases that we do not have, we do not find, and when we found them, about 41% of those cases, those missing cases, were in 4 regions here, the 4 regions of Zinder, Marabi, Tillabéri, and Dosso, which led us, therefore, to put in place a project to better the TB treatment coverage and reinforce the active research for the screening. Next slide. So the purpose of this project that we named RECAM, Research of the Missing Cases of Tuberculosis, is to organize and implement an active TB screening strategy among identified at-risk populations in order to increase the number of TB cases reported in the intervention areas by 15%. The process that we led and that we followed to elaborate that project was especially the first part of a data analysis in the operational part with literature review. We reviewed our algorithms to put in place a screening, an active screening with X-rays, with the portable solution. And we also did some trainings with cascade training, preparation meetings, and implementation of the project was from 2022 to 2024. Next slide. Here are the different interventions that we defined in that project. We had 3 of them. First implementation period was the approach of quality with using therefore that project with high frequentation. So we recruited different people that put in place different questions to screen the different cases of the patients that are coming. And as soon as the person has signs to suggest tuberculosis, the agent there is going to orient him towards the doctor or the nurse that's going to do so that he can go into the system. Second intervention that we had was the survey of bacteriologically confirmed TB cases, TB positive. And we went from the lessons learned during the union's CETA project MIO. It's the project contributing to the elimination of tuberculosis. And so from there, because we have pilot sites in the country, from there, we went further to the different areas to work on that project. For all patients that are bacteriologically confirmed and to have the survey on all of them, we went to their houses to see if there were no other cases and tried to break that transmission chain. And the third intervention that we put in place was a screening campaign with ultra-portable X-ray with CAD, and we put this in place in the vulnerable groups. In the different groups that we are going to define. So in the prisons, in the mining communities, and the different traditional communities, the different refugees, but also in the migrants, also in different regions. So the intervention coverage, you saw that there were 4 regions where we worked. But after the first year of implementation, we added Niamey because Niamey, we saw that there were some difficulties with the setup in place in Telabéry because of insecurity problems in that region. Next slide. So here's the project. We had the first implementation phase in 2022, and after that, the implementation phase was 2023-2024, and then we were able to convince the state to help us there to put in place some interventions from 2025 to 2026. And from there, as I said it before, we revised our algorithms and bought the tool and trained different professionals on how to use it and how to interpret the different images. And then we had some screening campaigns. Next slide. So what are the different interventions that we had? We had a screening campaign in the prisons. We included the prisons of the different regions, but we were not able to do the Niamey prisons. Also, we had them in we had those campaigns in centers that were screening via HIV. An NGO was taking care of those populations. and also the center of taking care of the different patients of HIV, which is mobile. That is in the case of the screening of HIV. We also bought a mobile vehicle that is equipped with X-rays to do that screening, that mass screening with the immigrants and the different nomads in the areas that is an area that's very known for that. We also had an organization in the refugee camps and internal displaced people, places where you have conflicts, the region of Difa, Tillabéri, where there are a lot of people that are displaced, linked to the insecurity and the conflict. Next slide. So all those strategies allowed us to have results. If we take the first approach that I told you about, the fact of sending the triage personnel in the different consultation sites, this allowed us to screen 6,917 cases of TB in those four regions between 2023 and 2025. Because the first year, because it was a preparation year and setup of the project, year 2022, we didn't have results. Next slide. The second strategy that we put in place was investigating the contact cases, meaning that we were visiting the different people who were screened to see if anybody else was also infected. And through that strategy, we were able to record 327 cases of TB between 2023 and 2025 in those 5 regions. Next slide. And therefore, with the 2 campaigns that we put in place, if we take both strategies that we try to put in place, the 2 different approaches, they allowed us to have 7,244 new TB cases. And if we try to do separate them between the notified cases of TB, this is about 14% of the notified cases in 2023, 25% in 2024, and about 22% for the first quarter of 2025 of the entire cases present. Next slide. So about screening campaigns with X-ray, we were able to bring the different screening campaigns in the prison areas and also the different places taking care of HIV. We also led campaigns in the poor quarters in Niamey, and through that strategy, we were able to detect and to screen 18 cases of tuberculosis, and among them, there's a case of tuberculosis MR that we're able to detect through that strategy. When we do that total of all the strategies, we detected this RECAM project allowed us to detect 7,262 new cases of TB in Niger. Next slide. Now, what was the impact of that project in the different regions where we put in place that strategy? Every year, it led an augmentation of the different screening, except In the Dosso and Tillabéri regions, we had a decrease due to, of course, the insecurity that's present there in the country. So some areas of that region were affected to insecurity problems. And in the Tillabéri region also, it's the area that's very at the frontier between Mali and Burkina, which is why you had a lot of people that moved around, which is why in 2024 we had the decrease in those two regions. But you can still see that in Marabi and Zinder, we had an increase, a progressive increase of the notification of those new cases in those two regions. Next slide. We tried to look also at the total of the cases, the notification of the cases that were expected. When we noticed that when we reviewed those, we had about 8,000 cases of 2020 that were missing, that we're not able to screen, and this strategy allowed us to reduce those missing cases to about, we went from 8,000 cases of missing cases to about 3,140 in 2024. So you can see that on this slide, the reduction of the missing cases is progressive because we are notifying way more and more cases. Next slide. Here are the key achievements that we were able to realize: the increased trade treatment coverage. We also implemented a systematic screening for TB signs and symptoms at entry points in triage officers, through triage officers. This strategy allowed us to implement the active screening of X-rays, and with the CAD for TB for at-risk and vulnerable populations. And it reduced also the chain of transmission because it allowed us to diagnose in time some tuberculosis cases that were contagious. Next slide. Now, the key challenges that we met were especially the case of sustainability of achievements through a systematic integration of lesson learned. The early detection to break the chain of transmission, because the question should be, the country is vast. We have a very big country. So just one device that we have for the moment, unfortunately, we have a decrease in the financing for TB screening. So the question of another device becomes more hypothetical, and we are reaching other partners also to see how we can get those. Next slide. As a conclusion, I would say that tuberculosis remains still a serious problem in the public health. A lot of progress was made, but the path is still long. But when we do see the reducing of the finances, the integration of the fight, innovation especially, innovation through the placement of those new technologies that we are integrating in our programs, we have also the mobilization of alternative resources that remains the only ways to hope to achieve the goals of ending tuberculosis by 2030. Before finishing, I would like to present to you a couple images. Next slide. You can see here an image of the training, the online training that was put in place for the different actors with the support of Delft imaging in Ghana. Next slide. Same training once again. Next slide. This is the preparation images for the mass screening in the poor regions. This is the technician, X-ray technician that's ready to welcome the people. Next slide. So this is the different material that we put in place. Next slide. Those are the different images. An image of a case that we screened. The image, of course, is not super good here on the. Sorry for the quality of the image, but you can still see it's on those cases where the left lung is almost gone, especially on the left. Huh? Next slide. I'm gonna finish by thanking very much all the partners here presented for the very good collaboration in the fight against tuberculosis for Niger. Thank you very much for your attention.